Okay, let's get into the routes of administration. So cannabis has widely variant pharmacodynamic effects depending on the route of administration, right? Cannabis is going to feel very different depending on how we consume it or apply it. So for this short presentation, we are going to focus on 3 routes of administration or methods of absorption. We're going to focus on inhalation, oral administration, and transdermal and topical. So when we talk about inhalation, we're of course talking about smoking, vaping, dabbing. We're talking about flower, also known as bud or grass, vaporizers, vape pens, concentrates, NDIs, nebulizers, and more. When we're talking about oral administration, here we're talking about edibles, right? Lots of those, baked goods, candies, mints, chocolates, condiments, tinctures, capsules, pills, sprays, film strips, drinks, and more. And then transdermal topicals, salves, creams, gels, sprays, patches, powders, body salts, lip balms, you name it. So let's start with inhalation. So smoking cannabis is the most common way of using cannabis around the world. Out of these routes of administration that we're talking about today, inhalation is the quickest way to get cannabinoids into the bloodstream. So, THC and CBD, that's the quickest way to get it into systemic circulation. So when we inhale that cannabinoid-rich smoke or vapor, it makes its way to the lungs. From there, it goes directly to the bloodstream where it quickly reaches the brain and vascular tissue. Now, the onset of effects when inhaling cannabis is pretty fast. In about 3 to 10 minutes, you're going to feel those effects. Now, this has its benefits and its detriments. The benefit is definitely if you need that relief right away, if you need that rescue right away, this is really great. Also, for cannabis naive, for people who don't really know the plant, it's easier to gauge, what they need. Do they need to medicate more or not? It's easier to gauge how you feel when you realize how you feel right away. It's easier not to overdo it. Now, the duration is relatively short, 60 to 90 minutes. Again, benefits and detriments. I think the great thing about that is that if you just need to use for a little bit and then move on with your day, you can do that. And the effects are strong psychoactive effects, but less intense than ingestion. Oral administration. Now, edibles are very popular in the United States, right? When we're talking about oral administration, we're talking about eating these products. So the rate of absorption with edibles is usually slow and unpredictable, and it varies a lot from person to person. So it really depends on the speed of your metabolism, what you have eaten or what you have not eaten, how much you have eaten, what medications you're under. So the rate of absorption, it varies from person to person. The onset is usually delayed, right? Because it has to go through the digestive system and get to the liver before it reaches the bloodstream. So about 90 minutes or more for patients and consumers to feel those effects. Now, again, benefits and detriments, right? I think that can have its benefits, but for the cannabis naive, you hear sometimes, a person who doesn't know how this works, they take a dose, wait some time, don't feel anything, they take another dose, and they have stacked doses now, right? So it's important to understand how it works and expect those delayed onset of effects. Now, the duration long, right? It can last several hours. So this can be good for those who need the therapeutic effects of the cannabinoids for a long period. When we eat these products, like I was explaining, it has to go through the digestive system and then to the liver. And then from the liver, it is metabolized before it reaches the bloodstream. When we do this, about 50% of the THC is going to be metabolized into 11-hydroxy-THC. Now, 11-hydroxy-THC is about 4 times stronger than THC, which is why those effects of edibles can be stronger than inhalation. It can be more potent. Now, when we have something that's more potent, all that means is that we need a lower dose to achieve those same effects. Like I said, the rate of absorption can be slow and unpredictable from patient to patient or consumer to consumer. Now, with edibles, I'm seeing a lot of innovation. I'm seeing a lot of new things. I'm seeing oral transmucosal delivery, nano delivery. So oral transmucosal delivery encompasses two methods, buccal and sublingual. Buccal delivery involves the inner lining of the cheeks and other areas such as the space between lip and gums on the upper and lower mouth. Sublingual is similar to buccal delivery, except sublingual goes under the tongue. Now, these areas are closely located to the bloodstream and allow cannabinoids to reach systemic circulation without undergoing first-pass metabolism in the liver. So the effects are going to be similar to inhalation. Nano delivery of cannabinoids also involves permeation into the bloodstream, bypassing the liver. And one more thing I want to talk about when we talk about edibles is the sugar content. Unfortunately, a lot of these edibles are packed with sugar, which is sad considering that one of the greatest benefits of cannabis are its anti-inflammatory properties, and sugar can undo that. Finally, transdermal and topical. So no first pass effect. These are things we're going to apply directly on the skin, right? So no first pass effect, non-invasive, can be steady infusion of the cannabinoids, can be rapidly terminated by removal of the device, single application for potentially multi-day therapy, and ideal to address local symptoms such as arthritis or peripheral neuropathic pain. Some of the limitations is that it can potentially irritate the skin. There is variation in absorption efficiency at different sites of the skin. You must maintain contact between the device and the skin, and there are differences in skin barrier functions between sites and between individuals.